Hi, my name is Hunter, and I'm a registered veterinary technician and one of the veterinary liaisons here at Alicia Pet Care Center, and I'm going to go over some dental home care instructions with you. As with any anesthetic procedure, some things we do want you to monitor for are vomiting and diarrhea. We do give an anti-nausea injection before our procedures, and it lasts about 24 hours, so we don't expect any tummy trouble. But let us know if you do see any breakthrough nausea signs with your patient. Another thing we sometimes see is some of our patients may not have a bowel movement right away post-op, and this is completely normal. We have some patients that go home that night and have a bowel movement. We have some that it does take a few days, and both are totally normal. The only time that we're concerned is if you notice your pet goes out to go to the bathroom and it looks like they are straining to go and having a hard time. If you see that, let us know. Otherwise, wait for nature to take its course. If your pet had any extractions today, we will let you know the number of extractions. Most of our extractions, we do place some dissolvable sutures in to close. There are some teeth, especially in kitties, that we may not place sutures in, but just know there might be some dissolvable sutures in there. Those will take care of themselves over a few weeks. Some things you may see after dental extractions, which are very normal, is you might see a very small amount of blood in the saliva for a day or so post-op. Kind of similar to how if we had like our wisdom teeth out, we might have a little bit of light bleeding, and that is normal. If at any point though you see any active bleeding, definitely let us know right away, because that could mean that a suture opened up or something like that, which we don't anticipate, but we would want to be let know about. As far as feeding goes after an anesthetic dental, if your pet did have any extractions, we usually recommend feeding a softened food for anywhere from 3 to 7 days post-op, and this can be achieved in a variety of ways. If your pet's on a dry kibble, you can add some hot water to the kibble, let it soak for about 15 minutes before you offer it so that it gets nice and soft. You can also buy a canned food. I always recommend trying to get something similar to what your pet's already on. That way, hopefully it doesn't cause any tummy upset. Or you can try one of the homemade type diets, like Just Food for Dogs or something that's very soft. Some pets need this soft food, others don't really care, but we do recommend, just for the sake of comfort, to keep them eating, that we do try a softer food for a few days post-op. Their first meal, the night of their procedure, we do recommend doing a small amount, so about half of what they would normally get, just so we don't overload the tummy. Don't be alarmed if your pet doesn't eat the night of a procedure. That's actually pretty normal with any sort of anesthesia. So offer the food that night, the half amount. If they eat it, awesome. If not, try again the next day. And they can have their full amount the day after their procedure. As far as medications go after a dental, we are going to go over the specifics of any medications we are sending you home with when we call you post-op. So you'll get those instructions on the day of. And then we do recommend, for pets that allow it, that we do awake teeth cleanings in between our anesthetic dentals. So if your pet will tolerate it, and as long as they don't develop any sort of disease, we do recommend trying to do an awake teeth cleaning within 3 to 6 months of the anesthetic to keep up with the work that was done on the day of the procedure. Another thing that you can be doing at home, if your pet will allow, is home dental care. So brushing your pet's teeth at home. In a perfect world, obviously they would get their teeth brushed twice a day, every day. A lot of people don't have time for that or even think to do that. My own cats, I'm not the best about it. But these are things that you can do to increase the odds of preventing dental disease. We always recommend using a pet-specific toothpaste because oftentimes they will swallow some of it, so we want to make sure it's very safe. And we do have a few different options as far as toothbrushes. We have finger brush kits, which are a little brush that goes right over your finger that you can get in there with. But that is something that if your pet will tolerate, you can do in the meantime at home between dental cleanings. And then last but not least, if at any point you have concerns about your pet during the healing process, reach out to us. If we aren't open, our phones automatically will forward to Animal Urgent Care in Mission Viejo. So they are there to help you too if you need anything, and it's after hours with us. Thank you so much for watching this aftercare video. I hope that you watch it before your procedure so that you're prepared. And if you have any questions, feel free to ask the day of surgery when we call post-op or even when you pick up your pet.